Is your question? So if you have read and understood, considering it communication skill station, kindly please begin.
Hello, I'm the SHO working for Mr. X. I'm calling to speak to the vascular consultant to ask him about a referral for a case which has a lower limb ischemia. Could I check that I'm calling to Mr. X?
Yes, you are. Can you summarize your case now?
Okay, a 54 years old lady has been admitted to us with mild diverticulitis. The problem is that upon which she received intravenous fluids and antibiotics, and she is improving on this. The problem is the patient now has an acute ischemia in her lower limb signs and symptoms, and the abdomen of her is soft. On drawing some bloods, it shows a metabolic, shows hypokalemia, and ABG showed metabolic acidosis. We also did some investigations for her. The ECG showed atrial fibrillation together with preventricular complex. Also, we did arterial duplex, which shows acute ischemia. We are happy to transfer this patient to your care for definitive treatment, please.
Do you think it's urgent? Can't you wait till tomorrow morning?
Yes, it's urgent. The patient has acute limb ischemia. It's an urgent situation, and it requires an early intervention for the fear of loss of the limb, please. So please accept our referral.
Don't you think you should consult cardiologist first because of the preventricular complex that patient has?
Okay, the patient indeed needs a cardiology consultation for her preventricular complex, but it can be done after the transfer and after your consultancy about the lower limb ischemia, because it is more urgent than the preventricular complex that may occur due to electrolyte imbalance.
What is your opinion about patients' presumed diagnosis of diverticulitis?
Yes, in the setting of her new symptoms of acute limb ischemia and atrial fibrillation, I have also to consider it might be a mesenteric vascular occlusion. It might be the cause for her acute abdomen. It might be a cause for her admission, not for her abdominal pain. Yes.
Yes. What are the differential diagnoses that you'll consider for this patient?
Yes, I might consider gastroenteritis. I might consider ischemic colitis. I might consider inflammatory bowel disease. I might consider I might consider also a ureteric pain. I might consider also she's a lady and might have it might have an oophorytes or salpingitis. And or pelvic inflammatory disease or rectal cancer or colitis.
Okay. Don't you think you should be doing abdominal scan before transferring the patient to us?
Yeah, the patient will need abdominal scan, yes, CT. But I think the transfer is more urgent for saving the limb. And for now, I will do some serial abdominal examination and also we can draw some renal function for her. And after the referral, she can, if the renal function is good, she can do a CT with contrast.
What do you think about the diagnosis of mesenteric ischemia?
Yes, for now the patient abdomen is soft and not tender,
Yes.
and it might be it might be a mesenteric occlusion, but for now we need to treat her limb first, and by doing serial abdominal examinations and the CT and also abdominal angiography, aortic angiography, we'll know is the presence of mesenteric vascular occlusion or not.
Then what would be your new diagnosis or new provisional diagnosis?
For
Considering the patient, yes.
for the abdominal pain, it might be a mesenteric vascular occlusion.
Okay. What imaging would you do then to rule that out or to confirm it?
I will do a mesenteric angiography.
Okay. Right. How would you manage the patient?
Okay, I have to correct the hypokalemia for fear of any cardiac problem, and I also need to correct the aortic, the atrial fibrillation, and I need to give the patient anticoagulation therapy, and also correct the metabolic acidosis which is present in the ABG.
Okay.
Yes, and after doing this, I need to refer the patient in an ambulance which has a cardioversion and also has a monitor and has a CPR for the patient to be to have an anticoagulation and the cardioversion to be completed when they become at your care.
Okay. What would you say to the patient's family? What would you
Okay.
inform them?
Okay, I will tell them that the patient has now symptoms of decreased blood flow to their to her lower limb, and for this reason, we are about to transfer the patient to a vascular consultant for a proper management for her limb to save her limb.
Okay. What is the viability time period in which the limb is viable?
About 6 hours, 6 golden hours.
Yeah, 4 to 6 hours. Okay. How would you take care of patients if you suspect mesenteric embolus?
Okay, I will give the patient low molecular weight heparin
Yes.
for the sake of blood thinning effect.
Yes.
And also I will give the patient a supportive treatment like fluids and antibiotics until they reach for you for the limb ischemia, and in your care you will reassess the patient and you will treat as you will find.
Who would you involve in the management of this patient?
Yes, in this patient, I will involve a surgical consultant and also an ITU registrar for the sake of the metabolic disorders, and also I will a cardiologist also will be with us,
All
and
right.
an anesthetist.
If ambulance, the one that you want, is not available, what would you do?
Okay. If there is no ambulance, a fully equipped ambulance, I might I might treat the patient in the hospital as I don't know.
Yes, resuscitate until the availability of the ambulance. Good. Now you can send over the patient.
Okay,
Thank you.
thank you.
Good.